we'll start the session, right? So, a lot of those questions we took, from the type of question they're asking in the exam. So let's start with the first question. So we'll go topic wise. So what I've done is I have arranged these questions topic wise so that we can understand the concept as well. So we are not just going to solve these MCQs. We are also going to talk about some, topics which are being repeatedly asked in the exam, and also we'll discuss, as we always discuss, some potential new questions. So there are certain trending questions which we see are being appearing in nearly all the exams. So we'll also talk about those questions. Great. Right, it's okay. So let's start the discussion. So along with this, we'll also revise. So let's start with the first question. See this question. The question is, a 24-year-old male presents to the psychiatrist with laughing 1 minute and crying the next without clear stimulus. Which of the following best describes the symptoms? And you have 4 options. So you have 4 options. Tell me all the options are related with affect. Very good. So the options are, is it incongruent affect, B, inappropriate affect, C, labile affect, or is it D, flat affect? Very good. Yes. So the first topic which we are going to discuss, very important, is we are going to talk about MSC. So let's discuss about MSC. So in MSC, the first heading which I'm going to cover is affect. So you'll see a lot of questions being asked from the MSC, that is mental status examination. So what is affect? All of us know affect is the expression of emotions. Our emotions are expressed on the face in our body language. So the right answer here is very good. The right answer here is, it is labile affect. So I always say, try to just remember the names and you'll understand the concept. Because Shakespeare ne to kaha hai what's there in the name, but I always say names are very important in psychiatry. You just remember the name, I'll help you remember the concept. So what is the meaning of labile or lability? Labile or lability means something which is rapidly or abruptly changing. So labile affect actually means that there is rapid and abrupt changes in emotion. Like in this case, we have not given any stimulus, but without any stimulus, the patient is laughing and then he starts crying. So this is labile affect. Can you tell me? Very good. Can you tell me where it is seen? In which situation it is seen? Can you tell me? 2 important conditions I want you to remember. What are those 2 important conditions? Tell me for labile affect. So the first important condition where you may see labile affect is, first is mania, and another important condition is organic mental disorder. So these are 2 important conditions in which you may see labile affect. Very good. Is it clear? So yes. Now also let's try to see some of the other options. Better tell me, what is this flat affect? Now again, when you do ECG, normally you see such waves on ECG. How is the ECG of a person who is dead? How is the person of ECG who is dead? Right. So please remember, you see a flat line. This is the meaning of flat affect. Flat affect, remember, sometimes also referred to as blunt affect. So what is this flat affect? In flat affect, you will see that I'm talking to a patient and I'm giving some positive stimulus. Let me say that recently, the patient was promoted in his job. Recently he became a father. So I'm giving some, happy news. I'm discussing some happy moments, but patient appears like this. There is no change in the affect. Now I'm discussing some sad moments. Let us say recently his parents died in a car accident. So I'm discussing some sad moments. मैं कुछ दुखी बात discuss कर रहा हूँ, but patient is looking like this. So can you appreciate there is no change in the affect? This is the meaning of flat affect. Now can you tell me where we find flat affect? Very important. This question was asked in one of the exams. So flat affect is which symptom of schizophrenia? So remember, flat affect is a negative symptom of schizophrenia. Very good. So we'll discuss negative and positive symptoms of schizophrenia. Very good. Let's also discuss the other 2 options. Now, what do you mean by inappropriate affect? Now, inappropriate affect means that the affect is not matching with the situation. So this is the meaning of inappropriate affect. Suppose a patient goes to the funeral of a family member. Somebody has died in the family. He goes to the funeral. Everybody is very sad, but he sees the dead body and he starts laughing. So can I say here the affect is not matching with the situation? So this is the meaning of inappropriate affect. Can you tell me where do you see inappropriate affect? Can anybody tell me where do you find inappropriate affect? Yes, again it can be seen in schizophrenia. And lastly, what is the meaning of incongruent affect? But incongruent affect means here the affect is not matching with the mood or the thoughts of the patient. So suppose I ask a patient, how is your mood? Please everyone see here. The patient says, sir, my mood is very sad. My mood is very sad. Can you appreciate what is happening here? The mood, this patient is saying that he is sad, but can you appreciate the affect is very happy? So can I say the affect and mood are totally opposite? They are not matching. So this is the meaning of incongruent affect. Again, it can be seen in conditions such as schizophrenia. I hope this is clear to everyone. So all these are important terms associated with affect. Is it clear? Very good. So this is about affect, a very important topic. Now let's discuss the next question. Everyone, let's see the second question. Answer this second question. A 35-year-old male admitted in the hospital with a diagnosis of schizophrenia. So I'll also highlight some keywords. See, when I'm discussing the question, my purpose also here is to also help you answer how to approach a MCQ. So the diagnosis is clear to us. Very good. He claimed that his wife present in the hospital is not his wife, but a hospital staff who wants to kill him, and even tried it 4 days back. He continues to claim it despite being convinced otherwise. So can I say this patient is holding a false belief? There is some problem in his thinking. Yes, we are dealing with delusion. So very good. Yes. So what is the most likely diagnosis here? Delusion of infidelity, Capgras syndrome, Fregoli syndrome, or is it delusion of love? Very good. The answer here is yes, it is Capgras syndrome. So let's discuss a VIP topic of psychiatry, that is the disorders of thought. Now this is a very important topic usually in every exam. So I say this as a VVIP topic, thought. So under MSc, now let's try to understand some abnormalities of thinking. So first of all of us know that the disorders of thought are divided into 4 domains, that is flow, content, form, and possession. Can anybody tell me delusion is a disorder of which of the following? Can you tell me? Delusion is a disorder of which of the following? It is a disorder of, yes, it is a disorder of content. So sometimes they may ask such very simple question that delusion is a disorder of content of thought. Now what is delusion? Very good. Delusion is a false, fixed, firm idea or belief. It's a false belief in the mind of the patient. So a false belief has come in his mind and it is fixed and firm. That means he's holding this belief with extraordinary conviction. No matter whatever I say, his belief is not going to change. So this is what is a delusion. Now very important, especially for your exams, but also remember this last line when we talk about the definition of delusion. These are unexplained by social cultural background. So can anybody tell me if a belief is false, but yet it is explained by social cultural background? For example, many of us might have heard this now, that some people believe that if a black cat crosses the way, something bad will happen. है ना, काली बिल्ली ने रास्ता काटा तो कुछ अपशगुन हो जाएगा. Some people believe it so firmly that they may stay on their place, may not cross by if somebody else have not crossed by. They may wait for half an hour, 1 hour. So this is also false belief held with extraordinary conviction, but we call it as very good. We call it as superstition. Very good. So the last line help us differentiate delusion from superstition. So delusion is not explained by the social cultural background, while superstition you can explain by the social cultural background. So let's discuss some of the types of delusion. First and very important point, but please remember delusion is a psychotic symptom. So it can be seen in psychotic disorders such as schizophrenia, and even in certain other conditions also you may see delusion. So remember delusion is a psychotic symptom. So let's try to name some of these symptoms. But let me know if the video is clear. I am able to see the video clearly. Right. So tell me, a patient thinks that somebody wants to kill me. So patient says my neighbor wants to kill me. I'm sure he wants to kill me. Father says, sir, he has bought a gun. He thinks neighbor is, planning to kill him. So what is this delusion? Or patient says that somebody wants to harm me. A child, a student says my college principal wants to fail me in the exams. Can you tell me what is this delusion? Very good. This is delusion of persecution. Patient thinks that people are talking about him. So there are two strangers very far away from the patient, but patient is sure that those two people are talking about me. He's not able to hear them, but he's convinced they are talking about me. Or he thinks somebody is spying on me. So can you tell me what is this delusion? Very good. I'm able to see the answers. Very good. Very good. This is delusion of reference. So please answer this question. Sometimes you will get such newer questions also. A patient while watching the news, he thinks that the news anchor is giving him some secret message. What is this? So he is seeing news and he thinks that the news anchor on the news is giving some secret message to him. So can you tell me which delusion is it? This is also delusion of reference. So please be very careful when such newer scenarios they may ask in the question. So the patient is thinking that, things around him are happening in reference to him. So this is again an example of delusion of reference. Patient makes big false claim. Patient says, I am the king of the world. Or patient may claim, I have supernatural powers. Just like Thanos, I can snap my finger and do anything. Or patient may claim that Prime Minister asked me, how should I run the country? I made Donald Trump the president of USA again. So patient is making such big false claims. Although his neighbor does not know him, but he's claiming such famous people knows him. So what is this delusion? Can anybody tell me? Very good. Yes, this is delusion of grandiosity. Now please remember, these are delusions or psychotic symptoms, can be seen in disorders like schizophrenia, but they can also be seen in other conditions. So for example, delusion of grandiosity can also be seen in mania. Very good. Yes, I have stopped the war. Yes. So sometimes you'll see such grandiosity. Of course, very good. So this is delusion of grandiosity or grandeur delusions. Now another delusion, patient denies existence of self. Patient says, sir, I'm dead from within. I don't have a brain. I don't have any intestine. Or he may deny existence of his loved ones. Sir, all my family members are dead. His brother is standing in front of me saying, what are you saying? I am standing living in front of you. He says, no, sir, everybody is just a plank of card. This world is a dead place. ये मरे हुए लोगों की दुनिया है. So can you tell me what is this delusion? Very good. As if he has become very negative. This is delusion of nihilism or delusion of negation. Now this question has been asked in various exams. Now Cotard syndrome. What is Cotard syndrome? Can you tell me what is Cotard syndrome? Very good. Yes. Cotard syndrome is when a patient with depression developing such delusions like delusion of nihilism. Now very interesting question was asked in one of the INI-CET exams. They had given a patient of depression and they said that he's saying that I am dead, I don't have a head. What is the point of eating anything? So it was shown that he's having delusion of nihilism. The question was asked, which delusion is seen? One option was delusion of nihilism and another option was Cotard syndrome. Can you tell me what was the right answer here? Option A was delusion of nihilism. Option B was Cotard syndrome. Okay. Is it clear to everyone? Tell me what is the answer here? Sometimes I always say this point is very important, that when you're approaching any MCQ, always read the last line very carefully. But in that question, they had asked which delusion is seen. So, sometimes you'll see such question, the concept, but still we mark incorrectly. Because the question was which delusion is seen, the answer was delusion of nihilism. I understand, such questions, sometimes are not questions of, psychiatry or medical question, more of language questions. So please read the language of the paper very carefully. Sometimes it is more about the language rather than the concept. Is it clear? Right. So let's discuss the next delusion, delusional misidentification syndrome. This is very important. Now, what do you mean by misidentification? But a misidentification means the person is not able to identify the person correctly. One important syndrome here is Capgras syndrome. See this. So, I'll tell you some tricks so that you're able to remember it from the name itself. See, the name itself will tell you what is Capgras syndrome. So, Capgras syndrome, just see the name. Close person replaced by a stranger. Like in this case, if you see this, like in this case, the wife is actually present in front of him, but he thinks that a close person, in this case his wife, has been replaced by an exact double. So, this is Capgras syndrome. So whenever you get confused in such questions, but always try to see that with whom the patient is fighting. See here, C for Capgras, remember C for close person. He's arguing, he's fighting with the close person now. He's fighting with the close person, that you're not my close person, you're someone else. So this is Capgras syndrome. Is it clear to everyone? Whenever you get confused, always try to answer the question like this. See this. Now, just opposite of Capgras syndrome we have is Fregoli syndrome. But what is Fregoli syndrome? Now, in Fregoli syndrome, patient is having an opposite belief. He thinks that a familiar person is imposing as a stranger. Somebody I know, somebody who's familiar to me is coming in front of me as, as a stranger and can take multiple appearances. For example, let's take a scenario. There is a patient, Mr. Freg. Let's call him Mr. Freg. He's walking and he sees one stranger. Let's call him S1. So he sees a stranger and he tells to the stranger that you are appearing like a stranger, but you are not a stranger. You are a close person. I know you are my wife in disguise. What are you doing here? Go back home. Go back home. He goes forward, meets another stranger. Let's call him S2. Again, He says that you are looking like a stranger, but you're not a stranger. You are my wife in disguise. What are you doing here? Let's go home. Let's go home. So he thinks a familiar person, in this case his wife, is imposing as a stranger. But please remember, nothing of this sort is happening. It is actually a stranger, but it's a false belief. So this is Fregoli syndrome. Again, whenever you have any doubt, always see with whom he is fighting. Tell me, in Fregoli syndrome, he is fighting with whom? Tell me, in Fregoli syndrome, he's fighting with whom? He's fighting with the stranger. Very good, with the stranger. So please remember this. Always try to see this. Let's just go back and come back to the video again, because I'm able to see it clearly. Most of us are able to see the video and hear me clearly. Is it clear, audible to everyone? Those who are not able to see, just go back and come back to the video again. Okay. Okay, in the tablet it is showing error. Some students are saying the tablet may be showing some error. Okay, I hope this is clear to everyone. Again, this is a very important, I always say some topics are hashtag topic. Nowadays anything which is trending, we put a hashtag now. So this is one important hashtag which I placed, very important. I hope this is clear. Let's complete this. Let's discuss some more delusions. So there are certain delusions with different names. De Clermont syndrome, also known as erotomania, also known as delusion of love. Now, if I ask you what is love, again, very difficult to define love. I'm not asking the philosophical definition. But when we say love, you say, I love that person. But what is delusion of love? In delusion of love, patient believe that someone else is in love with the patient. So the person says that, some other person is mad about me. Wo mera diwana hai. So this is delusion of love. For example, a 25-year-old female claims that Salman Khan is in love with her. She claims, sir, जो movie आई थी किसी का भाई किसी की जान, उसमें वो जो जान है वो मैं थी. The Big Boss show which Salman Khan hosts, that eyes of Big Boss is telling me that he is looking for me. Although the actor might have never met this patient. So this is delusion of love. So better please remember. So this is delusion of love. Another important delusion which has different names, Othello syndrome, also known as delusion of infidelity. But what is the meaning of infidelity? Can anybody tell me? What is the meaning of infidelity? Infidelity means that a partner or my spouse is cheating, also known as morbid jealousy. So here what is happening? Here the patient believes that my partner or my spouse is having an affair. A 40-year-old male considers or thinks that his wife is having an extramarital affair. Everybody is trying to convince him otherwise, but he's not getting convinced. So what is this delusion? This is delusion of infidelity. My question to all of you is, can you tell me an important substance in which this delusion may be seen? Can you tell me which substance I'm talking about? Is it cocaine? Is it cannabis? Is it amphetamine, or is it alcohol? Tell me which substance I'm talking about. Very good. Yes, the substance which I'm talking about is alcohol. So this may again can come as a potential question. So they may give you this history and they may just ask you which substance the patient may be consuming. Sometimes chronically consuming alcohol may lead to this delusion, but also remember these names. Sometimes they will ask the question with different names. So please remember, many times I've seen the question will be, they'll give you a clinical scenario and then they will ask you that which delusion is seen in the patient. So please be very careful. It's a very important topic which we have covered, right? Let's see the next question. Again, a very important question. Please be very careful. A 65-year-old male is brought to you by his wife as she has noted a personality change in the past few months. While the patient is being interviewed, he answers every question with the same 3 words. Which symptom best fits the patient's behavior? So can you tell me what is this phenomena? Is it circumstantiality, perseveration, delusion, or is it a flight of ideas? Is it clear? Yes, very good. So we have already discussed it is not delusion. So let's discuss, yes, it is perseveration, very important. So better let's now discuss the next heading of thought. So let's now talk about flow. So under flow, so flow means, just like a river flows. So please remember, now we are talking about abnormalities of flow of thought. Just like a river is flowing, thoughts are flowing in our mind. So sometimes there can be a problem of this flow. One important abnormality, but please remember, P for perseveration. Now what is the English meaning of perseveration? If I ask you, what is the English meaning of perseveration? You will say, sir, perseveration, somebody is persevering means doing thing again and again. So remember, P for perseveration, a thought persists beyond the point of relevance. Patient के mind में एक ही thought अब बार-बार it is getting repeated. So for example, if you ask the patient, what is your name? My name is Mukesh. It is relevant in this case. What do you do? My name is Mukesh. So now it is not relevant. Where do you live? My name is Mukesh. What is the name of your wife? My name is Mukesh. So can you appreciate now he's repeating the same thought again and again. So this is perseveration. Any Avengers fan here? Any Avengers fan? What is your name? I am Groot. What do you do? I am Groot. Where do you live? I am Groot. So this is perseveration. Again, if I ask you, tell me two important conditions. Tell me two important conditions where you may find perseveration. Remember this in this order only. So tell me two important conditions जहाँ पे आपको perseveration मिलेगा. Anybody? Very good. Yes. One condition is schizophrenia. Very good. But remember it to be number 2. Number 1, remember organic mental disorder. So please remember these are two important conditions where you may find perseveration. So sometimes you will see that a patient has answered some questions and then he may just repeat some of those words again and again. So this is perseveration. Very good. Now let's come to the next question. See this question. Now this is not in the paper, but I am giving you this question so that you understand. I'll give you some questions more than the test paper questions so that you are able to answer some of these concepts. See, a patient says, I am a lawyer, call my doctor because you are a liar. He is umpire, don't touch that wire, it's hot, hot like today's sun. Oh, my son is Mohan. Which of the following is seen here? Can you tell me which of the following phenomena is seen here? Now, tell me what is this? Very good. Now, although we know, very good, this is flight of ideas. Very good. Because although we know that in flight of ideas, usually the speed is increased. While if we talk about loosening of association, the speed is normal. Although in this question, they have not mentioned speed, but still you are able to appreciate that this seems to be flight of ideas. Very good. So this is flight of ideas. Is it clear? Yes. So let's talk about some other abnormalities under flow or stream. See, under flow or stream, we have talked about perseveration, which was problem in the continuity. That person was not able to go forward. He was stuck at one thought. Now, sometimes you'll see that the speed is increased. Speed is increased. Again, better don't mug up anything. Just see the name. The name flight of ideas is telling you that the ideas are on a flight. So here what happens that the patient, you ask a question to the patient, he will talk very fast. And he will talk illogical things will not make much sense, and ultimately he will not answer your question, that is goal is not reached. So patient is talking very fast, he will be talking things which are not making much sense and goal is not reached. But when you listen to the patient, you will see that there will be some connections between the thought. These connections can be by chance connection. For example, patient may speak like this, my name is Virat, I like playing cricket. Cricket is a game of gentlemen. Gentleman is my friend Mukesh. Mukesh smokes cigarette. Cigarette causes cancer. Cancer is my zodiac sign. So can you appreciate one thought is connected by other by a chance factor. ये मौसम की बारिश, ये बारिश का पानी, ये पानी की बूंदे तुझे तो ढूंढे, something like this. Or it may be connected by clang association or rhyming words. So patient may speak like this, Ram can sing, birds have wing, I am the king, phone goes tring tring, the weather is spring, bring. So can you appreciate everything is not making much sense, but it is connected by rhyming, that is clang association. So this is flight of ideas. I hope this is clear to everyone. Can you appreciate? Here you can see by chance connection also, and also you can see some rhyming. Is it clear? So this is flight of ideas. Very good. Now last important point. Better tell me flight of ideas is seen in which condition? Can you tell me? Name one important condition जहाँ पे आपको flight of ideas मिल सकता है? Yes, it can be seen in mania. Very important. Is it clear? So this is flight of ideas. Let's discuss another abnormality of flow. When the speed is reduced, very good. So speed is decreased. So there is one important abnormality, that is circumstantiality. But what is the English meaning of circumstantial? Can you tell me what is the English meaning of circumstantial? Circumstantial means when the person is giving unnecessary information. So what is happening here? The patient is talking slowly but giving unnecessary trivial information. But those information which you are not asked for. But still he is giving those information and ultimately he will answer your question. So I will say goal is reached. This is circumstantiality. So you can just remember it like this. So if somebody has to go from A to B, rather than going straight, he is going like this, giving unnecessary information, but ultimately he is reaching to the goal. So this is circumstantiality. For example, let me give you an example. You ask a patient, who is your favorite actress? A very simple question you have asked. So the patient may start like this, sir, Alia Bhatt acts very well. I have seen all her movies. In fact, I was upset for a few days when I heard she's getting married, but may God bless her. Even Katrina Kaif is a wonderful actress. I've seen most of her movies. I was upset for a few days when I heard she's getting married, but may God bless her. Even Kareena Kapoor Khan is a wonderful actress. I was sad for a few days when I heard she's getting married. May God bless her and her family. But my favorite actress is Kiara Advani. So can you appreciate this is circumstantiality? He is giving unnecessary information and ultimately he reaches the goal. Very good. Yes. Correct. Right. So this is circumstantiality. Right. In fact, let's try to answer this question. But please try to answer this question. So before coming to this question, let's complete this. So let's also talk about abnormalities of form. I hope flow and content is clear to everyone. Is it clear to everyone? Let's now talk about abnormalities of form. But please appreciate when we say form, what do you understand by form? But a form means, like this pen which I'm holding, it has a form, it has a structure. Similarly, our thoughts also have a form. Form means organization. So please understand, form means organization. So when this form is abnormal, we call it as formal thought disorders. So formal thought disorder, see, the name is telling you formal. The name is made up of form. So formal thought disorder means that the form is abnormal. So in formal thought disorders, can you tell me the thoughts will be organized or disorganized? You will say, sir, in formal thought disorders, the thought will be disorganized. So there is disorganization in thinking and subsequently there will be disorganization in speech. Right, so let's talk about some abnormalities of form. Also remember, these formal thought disorders can be seen in a very important condition which we'll discuss, that is schizophrenia. So in schizophrenia, many of these formal thought disorders may be seen. So let's discuss some of these formal thought disorders. But the first is loosening of association. Now see this. Again, don't mug up anything, but just see the name. The association between the thoughts has loosened up. So what is loosening of association? There is break in the logical connection. The thoughts which were once logically connected, now that logical connection has gone. So suppose if I ask a patient, what would you do if you want to have food outside? So the patient may speak like this, sir, I will come back, I will eat, I will reach cafe, black umbrella, I will pay. So can you appreciate, you'll say, sir, words are making sense, but I'm not able to understand what he's trying to say. So this is the meaning of loosening of association. Everything is hodgepodge. Now again, please remember how to differentiate it from flight of ideas. We know flight of ideas mein speed increased hai, yahan pe speed is normal, but written question mein speed is not mentioned. So we have discussed that flight of ideas mein you will see some connection, while in loosening of association there is no connection. So this is loosening of association. Let's now see the second abnormality. Again, just see the name. But if I ask you, what do you mean by derailment? A train is moving on track, suddenly gets derailed. Isn't it? This is the meaning of derailment now. So a patient is on track for some time and suddenly he changes the track. So this is known as derailment. And sometimes it is also known as night's move thinking. Night's move thinking. But how does a knight moves on a chessboard? So how does a knight or a horse moves on a chessboard? It goes straight and suddenly takes a right or left. This is what is happening in derailment. So there is jumping off the track to go to a different topic. So again, if I ask this patient, what will you do if you want to have food outside? He may start on the track. So he may start like this. Sir, I will book a cab. I will reach the cafe. And suddenly, rather than going on track, suddenly changes the topic. Sir, summers have begun. Now I have, taken out my summer clothes and I put off my winter clothes. So again, he just changed the topic. He was on the topic for some time. Suddenly he has changed the topic and there is no connection between these two topics. So this is derailment. So it's very important to call it derailment. It should be evident that for some time, beta कुछ देर के लिए patient track पे है, उसके बाद उसने track change किया. Now what is tangentiality? Again, just see the name. In school days, teacher would come in the class and say, draw a tangent to a circle. But what is a tangent to a circle? So it's a line which touches the circle at one point and it goes away. क्या tangent कभी circle पर वापस आता है? No, it does not come back to the circle. So this is tangentiality. That patient touches the topic and goes away. So tell me, goal is reached or not reached? So remember, goal is not reached. He will just touch the topic and he will go away. So this is tangentiality. है ना, नवाजुद्दीन सिद्दीकी का डायलॉग है ना, टक करके चला गया. So this is tangentiality. Is it clear? So this is tangentiality. We'll discuss important difference, but please remember, sometimes they compare circumstantiality with tangentiality. Circumstantiality में patient इधर उधर की बात he will say and he will come back to the goal. In tangentiality he will go away. Derailment और tangentiality में क्या difference है? In derailment, the patient is on track for some time and then he changes the topic. While in tangentiality, beta, from the beginning he is off track. So please remember the difference. Please remember the difference. Now let's talk about beta neologism. What do you mean by neologism? As the name suggests, neo means new, logos means word. So what is neologism? Beta, it means new word. You're talking to a patient and suddenly this patient starts saying, sir, I have brought a new Pratt knit kit with go, and suddenly you are confused. He was talking normally and suddenly this patient who only knows English language, he starts saying, sir, I bought a new Pratt knit kit with go. Apne Google kiya, there is no such word. You opened Oxford dictionary, there is no such word. And then he says, sir, it is white in color, it writes very well, still you're not able to understand. Then he points to his pen, sir, I bought a new Pratt knit kit with go. So can you know how he has used this word for this pen? No. So suddenly there is a new word in his mind. So this is, remember, this is neologism. And remember again, neologism can be seen in condition like schizophrenia. Another one, remember, is verbigeration, also sometimes referred to as word salad. So verbigeration or word salad means now the patient's speech is just a senseless repetition of certain words, sounds or phrases. I'm going who, ha, he, ha, wo, I'm going balle, balle. So there is just senseless repetition of certain words, certain sounds, certain phrases which are not making any sense, like a word salad. So these are certain abnormalities. Color of grass is red. But what was that? That was what buried in talking past the point. So talking past the point, what happens that the patient, answer will tell you that he understood the question, but he is talking around that point. So what is the color of grass? He says it is red. That is talking past the point. We have discussed what is Ganser syndrome. Ganser syndrome is when talking past the point is seen in prisoners. Remember, Ganser syndrome can be seen in gangsters. Okay, so that was Ganser syndrome. Very good. That was Vorberidin. Incoherence again means that you're not able to understand the speech. Sometimes these are very similar. Again, in incoherence, you're not able to understand. Everything is jumbled up, right? So that was Ganser syndrome. I hope this is clear to everyone. So we have discussed flow, content, form. So sometimes they will ask questions like this. So let's now, approach this question. But please see this, everyone. No, usually not seen in normal people. Usually not seen in normal. The term Ganser syndrome is specifically used for when it is seen in prisoners, but of course it can be seen in other people as well, right? Right, yes. We will come to obsession, but in a while. Just answer this question. A doctor asks a patient about her age. The patient responds, doctor, I am from a village. We were married at a very young age at 12 with my husband who is just 5 years older than me. Then I had 2 kids when I was around 18 or something. Now I'm 38 but look like their older sister dog. Can you tell me what is this? But please appreciate this. Why this is not flight of ideas? I'm very good that you are also thinking of flight of ideas. Dekho, flight of ideas and circumstantiality mein the key difference is speed. That in flight of ideas speed is very high. In circumstantiality the speed is reduced. You're very, in a way you're thinking in a good direction. That why not, sir, it is flight of ideas. Remember, in flight of ideas the thoughts are so fast that whatever the patient is saying will not make much sense. And there may be some connections. While can you appreciate here, whatever the patient is saying, everything is making sense. So this is more in favor of circumstantiality. Is it clear to everyone? Number one. Now tell me, is it circumstantiality or is it tangentiality? Very good. The important point is whether it is circumstantiality or whether it is tangentiality. Can you tell me here, the question was about the age. In this question, has the patient arrived to the goal? Has she mentioned her age? So see this, now I'm 38 but look like their older sister dog. She has arrived to the goal. So she has given unnecessary trivial information which was not necessary, but everything was making sense. And ultimately she has answered the question. So this, remember, is circumstantiality. But I hope this is clear to everyone. Please try to approach the question like this. Whenever you have any doubt, always see the options. Try to rule out the options and then you can say what is the right answer. Is it clear? Because in psychiatry nowadays we are seeing that yes, even in flight of ideas, goal is not reached. Very good. Yes. So you are able to differentiate these important entities. I'm very happy. Let's complete this table, a very important table, but ultimately let's talk about the abnormalities of possession. देखो, possession का मतलब है, if I ask you, the thoughts which are coming in your mind are your thought or your neighbor's thought? You'll say, of course, sir, I possess my thoughts. So in possession, first important abnormality is obsession. But please remember, for all practical purposes, remember, obsession is an abnormality of possession, and it's rhyming also. Now, what is an obsession? I'll discuss in great detail. These are repetitive thoughts images or impulses. What are impulses? Impulses means urges. So in the mind of the patient, but there are certain repetitive thoughts are coming, or some images are coming, or some impulses are coming again and again, maybe for 1 hour, 2 hour, 4 hour, 6 hours every day. So remember obsession again. In which condition can you see obsession? We can see obsession in beta OCD. I'll cover obsession in great detail when I'll come to OCD, a very important topic. Also see this thought alienation. Again, see the name. Always see the name. But a thought alien. My thoughts are not mine. It is under someone else's possession. Thought alienation, also known as passivity of thought. Now, please remember this point. Whenever in psychiatry you see this term passivity, passivity means under someone else's control. So passivity of thought means my thoughts are under someone else's control. Again, there are three phenomena. One is thought insertion. Thought insertion, from the name itself, you can see patient, experience that somebody is inserting thoughts in my mind. Sir, in my mind, there is a thought that I should go out and watch a movie. But sir, this thought is not my thought. Somebody has put this thought inside my mind. So ये thought insertion है. Thought withdrawal में, as the name suggests, sir, somebody is withdrawing thoughts from my mind. There was a thought in my mind, but somebody has taken it away. I don't know what that thought was. And lastly, remember thought broadcast. Again, as the name suggests, thought broadcast means patient says, sir, everybody is able to know my thoughts. My thoughts are getting broadcasted outside. Patient enters the room and patient says, everybody in the room is able to know my thoughts because my thoughts are getting broadcasted outside. So this is thought broadcast. So this was about thought alienation. Can you tell me where thought alienation can be seen? In which important disorder? Yes, it is one of the, yes, all these three are first rank symptoms of schizophrenia. Very good. I'm very happy you know this. So we'll talk about the first rank symptoms as well when I'll come to schizophrenia. But how to recognize circumstantiality? See this. When you ask a question, patient will give you unnecessary information, but that will make sense. And ultimately the patient will answer back your question. He will reach the goal. Like in this question, everything is making sense. Patient thoughts maybe, again, we cannot determine speed here, but can you appreciate everything is making sense, but it is unnecessary. And ultimately the patient has reached the goal. Is it clear? So this is circumstantiality. So beta, this is a very important table. Again, I'm saying VVIP topic of, of psychiatry, especially thought. Okay. Don't go in the exam without reading thought. Of course, beta, do go in the exam. I'm not saying not go, but please read the thought, concept very carefully because you are seeing a lot of such questions in the exam. Is it clear? But in tangentiality, patient will just touch the topic and will go away. Like in this case, the patient will touch the topic and may go somewhere else, may not come to this answer that I am 38. Okay, right? Thought alienation means that, patient thinks somebody is inserting thoughts, that the thoughts in my, mind is not my thought. Somebody has inserted them. Withdrawn means that somebody has taken away my thought. Broadcast means my thoughts are getting broadcasted through radio, television, or everybody is able to know my thoughts. Is it clear? So this is about thought. But before coming to the next question, let me also talk about some more concepts in MSc. Answer this question. But perseveration means the patient is repeating the same thought again and again. Initially it was relevant, but now it is not relevant. So he's stuck at one thought. So this is perseveration. Very good. A 30-year-old male is reporting of hearing the voice of his neighbors planning to kill him coming from outside of the room. He sees no one around but only hear the voices which no one else can hear. Can you tell me what is this phenomena first? Very good. Very good. First, can you tell me what is this phenomena? It's an abnormality of perception. Very good. But perception means, we can see things, we can hear things, you can smell things. There is a sense of taste and there is a sense of touch. So there is an abnormality of perception here. Very good. Here the patient is having hallucinations. Very good. So what are hallucinations? These are false perception without any real object. Have you seen this movie? Lage Raho Munna Bhai. In this movie, the actor Munna Bhai is able to see and hear Mahatma Gandhi. Mahatma Gandhi is no more with us, but he is able to see Mahatma Gandhi and able to hear him as well. So it's a classical example of hallucination. So hallucination is very clear to the person. It is independent of patient wills. Patient will say it will, come and go on its own, not under my control. And it is again without any real object. Without any real object. And where does a hallucination bit occurs? it occurs in the outer objective space, है ना? He is able to see and hear Mahatma Gandhi outside of himself, in the outer space. So this is a classical example of hallucination. It's auditory hallucination. So we know that it's false perception without any real object. It is correct, independent of patient will, as clear or as vivid as real. Like patient will say as if he's seeing it clearly, as if you are able to see me, he's able to see it that clearly. But remember, hallucination is not occurring in the inner subjective space. It is occurring in the outer objective space. So this is not true for hallucination. So tell me, what is pseudo hallucination? So pseudo hallucination and hallucination, they are very similar. Nearly all these characteristics are also of pseudo hallucination, but one important difference, can you tell me, of pseudo hallucination? But a very good. Pseudo hallucination occurs in the inner subjective space. Now what is this inner subjective space? Now let me tell you everyone. So all of us might have gone to a hilly area. If I ask you to create an image of the last hilly area you have been to, you'll be able to create that image in your mind. Now I say you have spend a lot of time, come back to the class, you'll come back to the class. But where that image was created, you will say, sir, in my mind, in the mind's eye. So that is known as inner subjective space. So if you ask me any example of pseudo hallucination, I'll say any example of hallucination is an example of pseudo hallucination. You ask the patient where he's experiencing. Patient says, I am hearing the voice coming from outside the room. So that is a hallucination. Patient says, I am able to hear a voice very clearly, not under my control, but it is coming from within. This is example of pseudo hallucination. Is it clear to everyone? Sir, I am able to see a man in the room which no one else can see. ये क्या है? Hallucination. Sir, I can see a man in my mind. It is very clear, not under my control. What is this? This is pseudo hallucination. I hope this is clear to everyone. Let's come to the types of hallucination. Again, it's a very important slide, but many times questions have been asked from this slide. Also remember, just like hallucinations, delusions we discussed, but hallucinations are also psychotic symptoms. So remember, hallucinations be psychotic symptoms hai. So there are 5 important types of hallucination, but one is auditory hallucination. That is, patient is able to hear. So remember, most common hallucination kaun sa hai? Overall in psychiatry, remember, it is auditory hallucination. But if I ask you overall most common delusion kaun sa in psychiatric disorder, can you tell me most common delusion? हमने discuss किया था ना, most common delusion कौन सा in psychiatric disorder? Can anybody tell me most common delusion is which delusion? Remember, it is very good. It is delusion of persecution. Very good. I'm very happy you remember this. Now, visual hallucination means he's seeing things not seen by others, but it could be anything. He's able to see some object, some animal, or even some humans. Now, very important key point, when you see visual hallucination, it's a very important point. One important diagnosis should come to your mind when you see visual hallucination in the question. Can you tell me which important diagnosis should come to your mind? Hallucination is a psychotic symptom, can be seen in psychotic disorder like schizophrenia. But question में visual hallucination है, tell me. Very good, yes. Remember, organic mental disorder, it's a very important point. Of course, it can be seen in other conditions like schizophrenia, even other conditions. But very important point, remember, organic mental disorder. Next is tactile. Tactile means sensation of touch. Patient says, I'm able to experience some insects crawling under my skin, over my skin. So this is tactile hallucination. Very good. Also known as formication. Also sometimes referred to as cocaine bugs or magnum bugs. Why is it called cocaine bugs? Very good. Why is it called cocaine bugs? Remember, because it can be seen with cocaine users. A patient comes to us with tachycardia, tachypnea and scratch marks. Can you tell me which substance patient is consuming? So patient comes with tachycardia, tachypnea and scratch marks. So this scratch mark is telling you maybe the patient is experiencing these tactile hallucination. Why is having tachycardia, tachypnea, I'll discuss when we'll talk about cocaine under substance. So patient may be consuming cocaine. But olfactory means he's able to smell something, not, others cannot smell it. Or gustatory means there is no food on his tongue, but usko kuch taste aa raha hai. Again, these are psychotic symptoms. Hallucination is a psychotic symptom, can be seen in psychotic disorders. Can you tell me an important, lobe abnormality? Suppose a patient had a head injury. Uske baad he developed these olfactory, gustatory hallucination. Very good. In the temporal lobe disorders. Very good. In the temporal lobe disorders you may find this. Very good. So sometimes person is having some temporal lobe trauma, tumor, or there is some infection. Patient may develop in temporal lobe epilepsy. Patient may experience such hallucinations as well. Very good. Now let's discuss one interesting special hallucination. So there are various special hallucinations. Let's discuss one of them known as reflex hallucination. But can anybody tell me what is another name of reflex hallucination? This was asked once in one of the AIMS exams. What is another name? Can you tell me what is another name of? Very good. Please remember it is also known as morbid synesthesia. Look, reflex hallucination is a special hallucination. Why? Because here a normal stimulus in one sensory modality, it could be auditory, visual, any sensory modality, it is producing hallucination in a different modality. So patient says, sir, whenever I switch on my radio, so he is hearing the radio, it is a real normal stimulus. You can also hear his radio. Sir, whenever I switch on my radio, I see colors in the air which no one else can see. So can I say here a auditory real object has produced hallucination? Which hallucination? Visual, in another modality. This is known as reflex. Like a reflex, hallucination is produced. Very good. Can you tell me the substance? So substances, hallucinogens such as LSD. Very good. So this can produce reflex hallucination. Okay, lysergic acid diethylamide. So LSD, it's a hallucinogen. So hallucinogens like LSD can produce such reflex hallucination. Is it clear to everyone? Patient says, sir, whenever I switch on the light, you can also see he switch on the light. I hear some voices in the room. So he's turn on the light. It's a visual stimulus and it is producing auditory hallucination. Again, this is reflex hallucination. But I hope this is clear to everyone. देखो, that's what I'm saying, it's a special hallucination. देखो, जो he seeing color in the air ना, that nobody else can see, that is carrying all the characteristic of hallucination, but it is produced by a normal stimulus or a real object. That is why it's a special hallucination known as reflex hallucination. Great. So let's complete the MSc with some of the other topics. So in MSc we also assess the cognitive functions, or some of them are also known as higher mental function. Let's discuss with some of these cognitive functions. But please, first of all, remember this important point. Because nowadays we'll talk about this point that organic mental disorders, they are also known as neurocognitive disorders. So can I say that these organic mental disorder or neurocognitive disorder, there is impairment of cognitive functions? So let's try to assess some of these cognitive functions. But the first important cognitive function, remember, is orientation. But what is orientation? As the name suggests, देखो, all of us sitting right now in the class, we are oriented ना. Oriented मतलब awareness of self and surrounding. So how do we check orientation with respect to time, place, person? If I ask you what is the time today, date, month, year, you will be able to tell me. Where are you sitting right now? You will be able to tell me. Who is around you? You will be able to tell me. So you are oriented. Suppose a patient is disoriented. So but a patient is admitted in the hospital, but he's saying I am at my home. So can I say he is now disoriented? So can you tell me in which condition you may find disorientation? It's a very important point which I'll discuss. But D say disorientation. Remember, D say delirium. Very good. We'll discuss this point, and we know delirium is a organic mental disorder. Is it clear to everyone? Right? Now let's talk about what is attention. Dekho, again, don't mug up any definition. In school days, teacher would come in the class and say pay attention. So teacher is trying to say don't focus anywhere else, focus on my voice. Attention ka matlab ability to focus. And how do we test attention? By performing digit repetition test. Matlab digits ka matlab numbers, repetition means to repeat. So I give some numbers to the patient, ask him to repeat. If he's able to repeat them, that means his attention is intact. But it has two important components. One is digit forward test. So one is digit forward test. In digit forward test, he has to repeat the numbers in the forward direction. Suppose I say 1, 5, he will say 1, 5, and then I will increase the numbers. And another is digit backward test. In backward test, he has to repeat in the backward direction. Suppose I say 5, 2, he will say 2, 5, and then I will increase the number. If both are given in the option, remember digit forward test is a better test to check attention. Next is concentration. But again, don't mug up anything. Concentration ka matlab kya hai? Sometimes when you're studying for half an hour, you say, sir, I lose my concentration. So concentration ka matlab hai sustained attention. So how do we test concentration? By performing 100 minus 7 test. Very good. Serial 7 subtraction test. I ask the patient to subtract 7 out of 100. Whatever answer comes, keep on subtracting it till you can. So normally at least 5 times. Normally a person is able to do at least 5 times. So this is how I'm checking concentration. A psychiatrist is performing 100 minus 7 test. What, cognitive function or what function he's assessing? He's assessing concentration. Is it clear? Let's also discuss memory. How do we assess memory? But again, remember, memory we can divide based on the duration into immediate, recent and remote. But the immediate memory means memory of the past few seconds. So if I ask you, what was the point we were discussing before memory? What was the point we were discussing before memory? But it was, you'll say concentration. That means your immediate memory is intact. Very good. So please remember, immediate memory, all the tests of attention and concentration in a way are also checking the immediate memory. But again, if they ask you specifically, then you can go with digit forward test. But again, of course, if the patient is illiterate, then we can check it with various other tests. Okay. So remember, this is immediate. Then what is recent? Recent memory means memory of the past few minutes, hours or days. That is recent memory. If something happened in the past few hours or few days back, you're able to remember, that means your recent memory is intact. But again, one important test, please remember for recent memory, this is very important. Please highlight this 24-hour recall method. So we ask certain things which have happened in the past 24 hours. If the patient is able to remember, we'll say his recent memory is intact, right? For example, very commonly we ask the patient, what did you had in your last meal? Suppose if I ask you, what did you had in your lunch today? Will you be able to tell me what did you had? You'll say, yes, sir, we had, somebody would say, I had rice, I had chapati. So that means your recent memory is intact. Because if they want to ask a newer question, they may ask you like this. A psychiatrist is asking a patient who came to meet you in the morning today. So again, what is the psychiatrist assessing? He is again assessing the recent memory. And what do you mean by remote? Remote means something which is very far. Person lives in a remote place, far. So remote memory means memory of the past few months or years. And remote memory we can assess by asking some personal information. Suppose I am asking a 70-year-old male. I'm asking a 70-year-old male the name of his, school friends, or name of his school, name of his wife, his children. So I'm asking some very old information and he's able to tell me, that means his remote memory is intact. But don't ask this male his date of anniversary. He may not be able to tell, ask other questions. Okay, just joking. So please remember, this is how we check the memory. I hope it is clear to everyone. Yes. Any historic event also which has happened in the life of the patient. Name the past 3 prime minister of the country which you have seen in your life. And such questions also you can ask. Very good. Yes, correct. But let's answer this question also. Before wrapping up MSc, let me ask you one more question. A psychiatry resident asks a patient similarity between a car and a plane. The patient replies that both have tires and both have windows. Which of the following function is being assessed? Tell me what is being assessed here. Abstract thinking, test judgment, insight, or is it remote memory? Remote memory, I'm sure you'll say, no sir, it's not remote memory. Insight means awareness of illness, so it's also not insight. Is it clear? So we are checking here, but very good, we are checking abstract thinking. See, abstract thinking means ability to form concepts or ability to understand the hidden meanings. So we have 2 tests. One is proverb testing. So we ask some proverb. For example, if I ask you, tell me the meaning of this proverb, pen is mightier than sword. And all of us have heard, kalam ki taakat talwar ki taakat se zyada hoti hai. So what is the meaning of this proverb? You'll say, sir, this means that knowledge is more powerful than muscle. So you're able to go deeper. You're able to understand the deeper meaning. That means your abstract thinking is intact. But let us say a patient says, sir, I'll tell you the meaning. That means if I'm fighting with someone and I'm holding a pen, other person is holding a sword, I will win because I'm holding a pen. So I'll say that the abstract thinking is intact or impaired. You'll say it is impaired. And impaired abstract thinking is known as concrete thinking. Very important point. But please remember this, that if the abstract thinking is absent, it is known as concrete. Concrete means superficial, is not able to go deeper. Another test is similarity testing. So we have 2 important tests for checking abstract thinking. In the question, they have asked similarity testing. But if I ask you the similarity between a car and a plane, can you tell me what is the similarity between a car and a plane? Anybody? So you will say, sir, both are means of transport, isn't it? That means you are able to tell me the functional similarity. But here in the question, the patient is only able to tell me that both have tires, both have windows. That means only the structural similarity is able to tell me, something which is just superficially, present. So he's not able to go deeper again. So I will say that abstract thinking is impaired here. That means यहाँ पे क्या है, concrete thinking. देखो, in the question if they would have asked कि what is seen, abstract thinking present or concrete thinking, then what you would have answered? Tell me what you would have answered अगर question होता कि यहाँ क्या दिख रहा है, what are you able to see, abstract thinking present or concrete thinking? Then you would have answered concrete thinking. Is it clear? So this is how we check the abstract thinking. Okay. Also remember one more point, test judgment. But a judgment means ability to make a right decision based on the circumstances. So there is one test judgment. As the name suggests, in test judgment we give a test. We give a hypothetical or an imaginary situation to the patient. Like we ask the patient this imaginary question. Suppose if your neighbor's house catches fire, what will you do? So if I ask you, what will you do, beta? If the neighbor's house catches fire, you will say, sir, I'll call the fire brigade. We'll try to save the neighbor. Some of us may say, arey sir, not so good people, let them burn. Okay, just kidding. So you may think like this. But one of the patients said, sir, you know what I will do? I will pour kerosene in the fire. So tell me, his judgment is intact or impaired? Again, it is telling me that judgment is impaired. Very good. Judgment is impaired. Again, remember, impaired judgment may be seen in psychosis. Very important. Okay. So please remember this. Okay. Very good. So we have covered some important points. So just remember some of these important points which we have covered of the MSc. So I wanted to discuss all these points, but especially this, because sometimes you will see questions being asked from these important headings of MSc. Okay. And insight means awareness of the illness, whether the patient is aware or not. Okay. So let's come to this table now. So before moving on to specific disorders, let's just understand this classification. Because when we make a diagnosis nowadays, we have two classifications. But one is DSM-5 and another is ICD-11. But let's discuss one older classification. In older days, the psychiatric disorders were divided into organic and functional. But organic means there is a visible cause. Like we'll discuss in delirium, there might be some cause, there may be head injury, there may be, electrolyte imbalance may be there may be some infection. Even in dementia, we'll discuss, but there may be some cause in the brain, there is atrophy like in Alzheimer's. So we'll see a visible cause. In functional, we say there is no visible cause. But please remember, I am not saying that there is no cause. Cause is there. But again, the cause is not visible from some of the basic investigation which we do. Like in schizophrenia or depression, if I do all the routine tests, I may not find anything. So that is the meaning of functional. But nowadays, nothing is functional. We know every disorder has some cause. So in earlier times, these were known as functional disorders, which are further classified into neurosis and psychosis. Let's now differentiate them so that you have an idea. Because sometimes just by knowing this classification, you will be able to solve many questions. Tell me, judgment is present where, absent where? In neurosis, judgment is present or absent? You will say, sir, usually it is present. In psychosis, the insight is absent. Judgment we have just discussed, it is present in neurosis, while it may be absent in psychosis. But delusions, hallucination, again and again I am telling you, ye kya hai? These are psychotic symptoms. So usually they are absent in neurosis and present in psychosis. But reality testing means ability to differentiate what is real, what is unreal. So neurosis may reality testing is present, while in psychosis it may be impaired. But at this point was once asked in one of the questions. So they had asked about one neurotic disorder and they had asked which is false statement. So neurotic disorder may reality testing is absent is a false statement. So sometimes just by knowing this, you will be able to solve many questions. Is it clear? Also now tell me, beta insight का मतलब क्या होता है? Awareness of illness. देखो normally हम medicine में surgery में हम illness के बारे में नहीं पूछेंगे ना. We will not ask the patient that are you aware of your illness, because patient is aware. But sometimes in psychiatry, patient will say, no, sir, I am fine. I think my family members have gone crazy, you treat them. But actual problem is with the patient. So patient, especially in psychosis, may not be aware of their illness. So this is the meaning of insight. But can you tell me some examples of neurotic illness? These examples are very important. I will discuss these disorders under these headings so that in your mind, it's very important to compartmentalize each subject. Dekho, in the exam you're sitting, You're carrying the knowledge of 19 subjects. Try to compartmentalize these topics. Very good. One is anxiety disorders. We'll discuss. Even OCD. Very good. Even some of the somatoform and related disorders. Very good. We'll discuss. Even depression to an extent, I can say. Isn't it? Yes. Now give me some examples of psychotic illness. Very good. You'll say one example, sir, is schizophrenia. Then some other example like acute psychosis. We'll discuss. Even, mood disorder and depression has, a lot of characteristic of neurosis, while mania or bipolar disorder has characteristic of, psychosis. But as we've discussed, sometimes even in depression, patient may develop delusions, hallucination. That is known as psychotic depression. So that is why I'm saying it's not a very crystal clear classification. But this classification will help us understand the disorder. So what I'll do, we'll first cover some organic disorders. Then we'll come to psychotic disorders. We'll discuss mood disorder, and then we'll come to neurotic disorder. Sometimes if you are just able to diagnose whether it is neurosis, psychosis, you're able to solve many questions. I hope this is clear to everyone. It is making sense now, right? So let's now come to the next question. Let us see this question. So we have covered a very important topic. Let's now come to this question. Question number 4. A 65-year-old male was admitted for knee replacement surgery. On the second post-operative day in hospital, he started saying irrelevant things, would continue to say that he is at his home. He would appear irritable and would also sometimes try to remove his catheter. So he's also agitated. Increase in the activity is also there. Can you tell me what is the diagnosis here? Very good. Acute stress disorder, mania, acute psychosis, delirium. Tell me, all of you are saying delirium. Very good. Can you tell me one important point which is telling you that it is delirium? Can you tell me the keyword in the question? You should also answer why you are saying delirium, because it's very important. Better tell me why you are saying it is delirium. I'm very happy. Look, post-op is a hint for you, but not it's not a definitive point. Very good. What is the important symptom? Look for the key important symptom. But this is the key symptom. Very good. He is at his home. Can you appreciate? देखो, age elderly है. Sometimes, you'll see that elderly age is given. Post-operative patient, like, after the surgery, second day, third day after operation, very commonly seen. But the key point is that there is impairment of consciousness, which is being suggested that he is at his home, he's saying. That means disorientation shuru ho gaya. Yes, the answer is delirium. But let's discuss the organic mental disorder. As we discussed, these are now known as neurocognitive disorders in DSM-5 and ICD-11. So there are 3 important disorders. One is delirium, dementia, and amnestic disorder. Again, it's a very important point. Let's discuss. Now, see, very importantly, in delirium, the consciousness is impaired. This is the key point. This is the key point. That patient ka consciousness is impaired. So there is impairment of consciousness, means that awareness of self or surrounding is impaired. But again, I'll give you a very simple mnemonic. Remember A, C, D, C. If any of these points is mentioned in the question, that is telling you that consciousness is impaired, that means the diagnosis is delirium. So they may tell you that A for altered sensorium hai. Clouding of consciousness, that consciousness is clouded. D say disorientation, patient time, place, person se disoriented hai. Or somewhere in the question they will tell you ki confusion hai. So remember the mnemonic A, C, D, C. If any of these points is written, that is telling you that consciousness is impaired. So see this, it's a neurocognitive disorder. Even there is cognitive impairment. So patient may have impairment of memory. There may be impairment of language. We'll discuss all these cognitive functions when we'll discuss dementia. Even perceptual abnormalities can also be there. Can anybody tell me which one important perceptual abnormality can be seen? One important perceptual abnormality can be seen in delirium. See this, I'm giving you a hint. Perception abnormality. Abhi we discussed this point. Remember this, we discussed? Yes, visual hallucination. So patient in the ICU may be saying that I'm seeing someone in the room, or there are snakes crawling on my bed. So visual hallucinations can be seen. Very good. Yes, visual hallucination can be seen. Now also remember that when we do EEG, sometimes they will ask such newer question as well. जब हम EEG करते हैं, so any patient, any cause of delirium, whether it is head injury, infection, any cause, if you do EEG, but what is one important finding on EEG? You will see diffuse slowing. Remember, there will be diffuse slowing of the cortical background activity. But there is one exception, one important exception you can remember. But there is one cause of delirium जिसमें EEG will show fast activity. Can anybody tell me in which important cause of delirium there will be fast activity on EEG? Remember, very good. Alcohol withdrawal delirium, or you can say delirium tremens. Even benzodiazepine withdrawal delirium may also produce these fast activities. So this may come as a question as well. So better please remember. Now lastly, let's finish this. Let's talk about the treatment. How will you treat a patient with delirium? Always remember, treat the cause. Delirium is a medical emergency, but it is reversible. So remember, it is reversible in majority of the causes. So you identify the cause and treat it. But if they ask you what is the drug of choice for delirium, so we may give drug to manage some of the symptoms. But if they ask you drug of choice for delirium, then you can go with antipsychotics. And most common antipsychotic we use is haloperidol. Other antipsychotic like olanzapine and other drugs can also be used. In fact, remember, most common is haloperidol. Now also tell me, in one of the causes of delirium, in one cause of delirium, benzodiazepine is the drug of choice. Now, using benzodiazepine in delirium is a bit tricky because benzodiazepines are also seen as suppressant. So sometimes they can worsen delirium, but yes, sometimes we can use benzodiazepine when the patient is very agitated. Low dose we can use. But there is one cause of delirium. Can you tell me where benzodiazepines are the drug of choice? Very good. I'm very happy. So remember, delirium tremens. But I hope both the questions are clear. अगर पूछें delirium में drug of choice, then you can go with antipsychotic. If they ask delirium tremens में drug of choice, then you will say it is benzodiazepine. Very good. I'm very happy. Very good. Lastly, can you tell me this question's answer? So let me ask you a differential diagnosis. देखो, a patient comes to us with acute onset, suddenly, let us say 2-3 days में symptoms have occurred. He is having fever and delusions, hallucinations are also seen. One important differential diagnosis you will make is delirium. Can you tell me one more important differential diagnosis? A patient may present with similar condition in which other diagnosis? Can you tell me which diagnosis I'm talking about? Anybody? Can you tell me which important diagnosis I'm talking about? Yes, very good. Acute psychosis. I'm very happy. Yes, acute psychosis. But please remember, acute psychosis, because fever I'm telling you here itself. Sometimes in acute psychosis also you may see this presentation that after fever the symptoms have started. So remember acute psychosis. Acute psychosis is when symptoms are similar to schizophrenia but duration is less. And how will you differentiate? Very good. How will you differentiate? एक तो आपने delirium का ना, जैसे malaria could be again can lead to, if it reaches the brain, it can cause delirium. That is one important diagnosis. One more is acute psychosis. Then differentiate कैसे करोगे? Can you tell me how will you differentiate delirium from acute psychosis? Now tell me the key point. I have told you this consciousness is impaired, but somewhere in the question if they mentioned these points, AC, DC, any of these points, then it is likely it is delirium. Otherwise think of acute psychosis. I hope this is clear to everyone. Very good, very good. Yes. Now let's come to the second neurocognitive disorder, that is dementia. But please see everyone here. In delirium I said consciousness and cognition both are impaired. In dementia I am saying that consciousness is intact. It is only the cognition which is impaired. Is this point clear to everyone? So dementia may, it is only the cognition which is impaired. So patient may have, amnesia. Amnesia is when the patient is having problems in the memory. Okay, then it may be aphasia. What is aphasia? When the patient is having problems in language. So family members will complain that he's not able to use words properly. He's making a lot of grammatical errors. Then next is, remember, apraxia. Beta, what is the meaning of praxia? Praxia means movement. Apraxia means there is problem in fine movements, learned movements. The patient is not able to make. So family members will give you this history that he's not able to comb his hair. He's not able to button and unbutton his clothes, not able to tie and untie the shoelaces. So I'm just trying to give you a clinical picture also because this may be given. Then there may be agnosia. The patient is not able to identify. The patient is not able to identify object. So in the neurological examination, you show some object like this pen, he'll not be able to identify. So that is agnosia. But sometimes he will not be able to identify certain faces. Can you tell me which term we use for this? He's not able to identify faces. That is known as prosapognosia. Please remember prosapognosia. Because sometimes if you are not able to remember these terms now, always see the terms. In psychiatry, I always say sometimes just by seeing the terms. देखो last में agnosia is coming ना, So when he's not able to identify faces, that is known as prosopagnosia. So patient is having cognitive impairment in 2 or more of these important functions, then we say the patient is having dementia. Is it clear to everyone? Now please remember, the key difference between dementia and delirium is impairment of consciousness. There are so many other differences also, no? Like we discussed, delirium has an acute onset, while usually dementia, most of these cases you will see that they have a insidious onset. They have a insidious slow onset is there, and majority of the causes of dementia, they are irreversible, while we know in delirium many of these causes are reversible. So these are some important points of differences. Is it clear? Now lastly, can you appreciate amnestic disorder? The delirium में both consciousness and cognition is impaired. In dementia, only cognition is impaired. In amnestic disorder, can you tell me what is impaired? Just see the name. So see, only out of cognition, it is only the memory which is getting affected. Very good. And one important, can you tell me one important cause of amnestic disorder, associated with alcohol? This is one important point I want you to remember. So there are so many causes of amnestic disorder. There can be CNS causes like tumor is there, or trauma is there, infection is there, and there are systemic causes. Can you tell me one important cause associated with alcohol? Thiamine deficiency is a कौन सा? Very good. Which condition are we talking? Wernicke's है या Korsakoff है? Very good. It is Korsakoff. Very good. Korsakoff. I will talk about Korsakoff syndrome. We'll discuss about Korsakoff syndrome in a while. In Korsakoff syndrome, again, anterograde or retrograde amnesia, both can occur, but anterograde more than retrograde. We will discuss, and this actually is because of vitamin B1 deficiency. I hope you have understood this concept, right? So please remember the concepts like this so that you're able to, make a diagnosis in the exam. See this question now. Yes, confabulation we will discuss, can be seen in Korsakoff also. Very good. But again, it's a PYQ. Which of the following are reversible cause of dementia? Tell me, NPH is reversible or irreversible? It is reversible. Hyperthyroidism. बेटा acute psychosis, मैंने आपको कहा कि patient has symptoms of schizophrenia but duration is less, and sometimes even acute psychosis can have fever in the onset. So आपको पता है delirium में भी delusions, hallucinations can occur and acute onset is there. So how will you differentiate? Very important, consciousness is impaired in delirium while it is intact in acute psychosis. Hyper, it is again reversible. Lewy body dementia, Lewy body disease, it is irreversible. Vitamin B12, it is reversible. So the right answer is option D. But let's discuss some important causes. It's a PYQ. They may just ask you direct questions. So we discussed that dementia, usually it is progressive, but there are 10 to 15% causes which are reversible. So that is why it's very important to always try to identify if my patient is having any reversible cause. So there may be neurosurgical causes like SDH, subdural hemorrhage. There may be some brain tumor, brain abscess, or NPH, that is normal pressure hydrocephalus. And what is the classical triad of NPH? Tell me what is the classical triad? Cognitive impairment, gait abnormality, magnetic gait, and urinary incontinence. Okay, so remember. So this classical triad may be seen. So if I ask you, would you like to do a brain scan in patient with dementia? Yes. Sometimes you may find some of these causes. Is it clear? Adams triad, Hakim's or Adams triad, sometimes known as. Very good. Now, then patient may have certain infection like encephalitis, meningitis. You treat them, then you'll see dementia may be reversed. But can you tell me deficiency of one important vitamin which can cause, very good, which can cause reversible dementia? अगर एक vitamin deficiency आपसे पूछते हैं, so can you tell me? Remember, then you will say it is vitamin B12. But other deficiencies like niacin, folate, even B1 can also cause the reversible dementia. And in the endocrinal causes, see all these important causes: hypothyroidism, hyperthyroidism, hyperparathyroidism can also cause reversible dementia. If they ask you one important endocrinal abnormality, then you can choose hypothyroidism. In others, can you tell me one important substance a patient is consuming and chronic use of this substance can cause dementia? I have to tell the patient stop this substance and dementia may be reversed. Even the brain changes may be reversed. So tell me which is the substance? Very good, alcohol. So tell me, the question may be asked like this: would you like to do a vitamin B12 level check in a patient you are thinking of dementia? Yes. Would you like to do thyroid function test in the patient? Yes. Because what if my patient is having some reversible causes? So sometimes question may be asked in this clinical sense also. So please be very careful. Okay. This is a very important table. Again, I am highlighting this, very important. Okay. But answer this question again, a very important topic which we'll cover. First, tell me the diagnosis and then we'll try to answer this question. See this question, everyone. A 70-year-old female brought by the family members as she is having difficulty in doing activities of daily routine. So somewhere this is telling me that patient is maybe having some cognitive impairment because of which the patient is not able to do activities of daily routine. There are also visual hallucinations and also symptoms of rigidity, bradykinesia. Some Parkinson-like symptoms are there. In the brain, they are telling you that Lewy body is present. Can you tell me what is the diagnosis here? So, yes, very good. So, tell me two diagnoses. Chalo. All of you are thinking of Parkinson disease na, because ye PYQ tha. Very good. But, in fact, remember there are two possible diagnoses. One is Lewy body dementia or Lewy body disease, and another is Parkinson disease. Parkinson disease dementia. Parkinson disease can also cause dementia. So please remember, we have two differential diagnoses. We'll discuss how to differentiate. Here, from the options, it is high likely that patient may be having, patient may be having, yes, patient may be having Lewy body dementia. In fact, tell me which of the following is incorrect. Capgras syndrome may be present, part of the presentation, true or false? True or false? Acha, ab beta, I've told you the diagnosis, that the diagnosis is Lewy body dementia. Okay? Option se hame lag raha that we are talking about Lewy body disease. Can you now tell me which is a false statement? देखो ये थोड़ा सा tricky question है. This is slightly tricky question. बेटा A, B, C, D. Which of the following is incorrect बताना है आपको. बेटा incorrect. This is a tricky question. Let me see if anybody can answer this question. Very good. Yes, Dr. Deepak. Yes, very good. Yes, you're saying C, very good. Dekho, even if you don't know some of the options, but you definitely know the core features. Is repeated fall syncope a core feature? Is repeated fall syncope a core feature of Lewy body dementia? We have talked about this now. Very good. That is what I am saying. Kabhi you will see a question in which you may not know some of the options, but there may be some options which you would definitely know. You definitely know the core features of Lewy body dementia. And yes. So is it clear? Dekho, tabhi maine kaha. That's why I'm saying one or two options may be confusing, may be difficult, but you will see some easier options will be there. So don't be disheartened if you don't know one or two options. So let's talk about Lewy body dementia. It's a very important topic. Okay, so it's a very important hashtag point. And before discussing Lewy body dementia, let's just briefly discuss. Beta, we know one of the classifications of dementia is cortical and subcortical, isn't it? Cortical may we say cortex is involved first and then the subcortex may be involved, while in the subcortical dementia it is the subcortical gray matter which gets affected first. Many a time they have asked examples, so please be very careful, like Alzheimer's disease is one of the examples, even Pick disease. Pick disease is also known as frontotemporal dementia, so name is telling you it is cortical. While Parkinson disease, Huntington disease, multiple sclerosis, Wilson's disease, PSP, progressive supranuclear palsy, all these are subcortical dementias. Now usually when you talk about these subcortical causes, like in Parkinson, you see tremors, rigidity, bradykinesia are usually the initial symptoms. So can I say that motor system is usually normal in the beginning, may get affected later on, while in subcortical dementia you will see that the motor system may be abnormal since the beginning. Also tell me, there are certain causes of mixed dementia like vascular dementia. Vascular dementia is a mixed cause, so vascular event can occur in subcortical or cortex, any area, and even Lewy body disease. It is a mixed dementia, so cortex and subcortex both may be involved. Is this point clear to everyone? Now see this. So let me first talk about this Lewy body dementia ke core features. But earlier there were 3, but now one more is included, so that becomes a potential question. And I have told you that trick now. So Mr. Lewy, he comes for the interview. And the interviewing person asks Mr. Lewy, show your CV, Mr. So remember CVMR. So what is C? Dekho, if cortex is involved, you will say, sir, there will be fluctuating cognition. Cognition is impaired and that is fluctuating here. So there will be variation in attention, alertness. What is V? This we have already discussed now. देखो, visual hallucination is the most common hallucination in organic disorder. Here it is present as the core feature, visual hallucination. Beta, what is M? देखो, when the subcortex is also involved, so you will see motor features. So motor features of Parkinsonism like tremors, rigidity, bradykinesia. And what is R? Can anybody tell me what is R now in the core feature? Very important, remember, REM, sleep behavior disorder. So this may come as a potential question. These are important core features. Then there are certain suggestive features like the patient may be having severe neuroleptic sensitivity. Neuroleptic means antipsychotic. So there may be sensitivity to antipsychotic. So there is high potential to develop EPS, extrapyramidal symptom, which we will discuss. There may be repeated falls, syncope. Please highlight this. They may be asked in the exam. So repeated falls, syncope, it's a supportive feature. There may be transient loss of consciousness, severe autonomic dysfunction. Hallucination in other modalities can be seen. But remember, sometimes delusions can occur, like delusion of persecution. Can you tell me one more delusion, important delusion, can be present as a presenting symptom? Remember we discussed this na, Capgras syndrome. But see this. Sometimes patient may present with Capgras syndrome, and later on when you take a history, you may also be able to see features of Lewy body dementia. Even other symptoms like depression can be there. So these are some supportive features. So I'll just highlight some of the important ones. Please try to remember some of these important supportive features. Okay, so there are core features and then there are some supportive features. Also in investigations, can anybody tell me what is this with a pinkish central core and surrounded by a halo? Beta, what is this known as? What is this finding in pathology you see? So you'll say, sir, the name is telling us Lewy body. Lewy body, these are alpha synuclein. So please remember. But remember, these Lewy bodies can also be seen in which one important condition? We just discussed Parkinson disease. Even in Parkinson disease. So Parkinson disease is a close differential diagnosis of Lewy body dementia. On the FDG PET scan, you may see hypometabolism in the occipital region. But there is a relative sparing of the posterior cingulate cortex. So this in fact is known as the posterior cingulate island sign. So like an island is formed and it may be seen in the initial stages. So in the initial stages, sometimes it helps us differentiate from Alzheimer, but later on this may go away. So in the initial stages, this may also be seen on the FDG PET scan. Is it clear? So now let's come to this question. Now tell me, Capgras syndrome may be part of presentation? Yes. REM sleep behavior disorder can be seen? Yes, we know. And posterior cingulate island sign on FDG PET scan? Yes. Repeated false syncope is not a core feature. But suppose if they give you both the options, Lewy body dementia B and Parkinson disease dementia B, then can you tell me how will you differentiate? Because both of them may have very similar symptoms. Please remember, Parkinson disease is a subcortical dementia. Here you will see when you take a history, motor symptoms will be first followed by cognitive symptoms, and usually in the research criteria 1 year duration criteria is used. So we say that after the onset of motor symptoms, 1 year later cognitive symptom would begin, or maybe thereafter later on. So please remember this. While in Lewy body dementia, cognitive symptom you will see plus minus motor symptom. Motor symptom may be there in the beginning or may occur later on. I hope this point is clear to everyone. It's a very important topic. Please remember Lewy body dementia. Now if I ask you, beta, what is the most common cause of dementia overall? Beta, what is the most common cause of dementia overall agar puche? So you will say, sir, Alzheimer's disease. Second most, remember now it is Lewy body disease. Please remember this point. Vascular now is the third most common. Vascular dementia is the third most common. And can you tell me which important pattern can be seen sometimes in vascular dementia? We have talked about this. You know, in the videos also we've talked about which important pattern. Even in the image based session we discussed what is that pattern known as? Not PrepLadder, step ladder. Very good. Remember step ladder. Very good. Yes, not step ladder, but you can not PrepLadder but step ladder. Yes, pattern can be seen. Very good. Okay, pattern can be seen. Is it clear to everyone? I hope it is clear now. Right. Very good. So with this again, I'll say thank you so much for your patience. Thank you and all the very best. Okay. Thank you. May God bless you.